good, right? Welcome to the online provider medication reconciliation tutorial. Medication reconciliation will be completed in NetAccess. Providers will access this through CareExpress. Upon admission, the nursing staff will collect home medications. Once the home medications are entered into NetAccess, the medication reconciliation orders will be printed and placed in the order section of the patient chart. When every medication is addressed by the provider and the form is signed, it will be faxed to pharmacy. I'm now going to log on to the NetAccess test system just to show you the process. Provider will select the patient. In this case, I'm going to go to 7 North, and I'm going to select my patient from the list. When the patient is ready to be discharged, the provider will perform the discharge medication reconciliation and generate the discharge medications instructions, which will print out at a printer based on the location of the patient and have an electronic signature of the provider. The nursing staff will review the discharge medications instructions with the patient. So I'm going to select medication reconciliation on the left. As a provider, I'm going to do reconcile discharge. What you hear is all the medications at the top are the medications the patient came home into the hospital on. And then we have the active in-house orders. To determine which medications you're sending them home on, if you're going home, you click the arrow and it moves the medication to the right side on discharge medications. You'll notice that in the active in-house orders, it X'd out or discontinued Colace because it's a duplicate of what we're sending them home on. You continue to do this going through the medications top to bottom, one at a time, reviewing them. As you click the arrow, it will move it over. If you discontinue a medication, you click on the X and it will gray out, and you have to give a reason on the bottom for home medications that are discontinued. So you can say condition no longer warrants and then say OK. Continue to go through the same process for sending them home on it or discontinuing a med. If for some reason you need to pen a medication, you would hit the P. It'll turn purple, go over to the right side until you determine whether you want to send them home on it. Continue down through the list, either accepting or discontinuing. At this point, you're going to pen the medication. On the bottom right side, you'll see penned, because you need to go out and check whether or not you're going to send them home on this medication. So I penned it. It tells me my function's been processed. When I'm ready to determine that, I go back in and say reconcile. It will tell you that the reconcile has already been performed because it's been pended. You're going to say OK. And the pended medication on the right, you're going to select it and you're going to determine whether you're going to remove the medication from their home meds or you're going to update the discharge meds. If you're going to send them home on it, you will update. If you're not, you will remove the medication. It'll go back to the left, and then you'll hit the X to discontinue that medication. Again, because it's a home medication, you have to give a reason why you're discontinuing, and then you'll say OK. If you need to add a medication that's not in this list, you would go through search for new medications. You could use the drop down in the search for, choose the medication, and hit search. It'll give you a list of those medications. You choose the one that you want with the right dosage. It fills in the bottom, giving the name of the medication, the strength. Your dose, unit of measure, route, and frequency must be completed in order to add this to discharge. The dose means how many. In this case, these are tablets, so how many tablets? So if it's going to be 1, you put in 1, it's 1 tablet, PO, and then you have to indicate the frequency by clicking the question mark. I'm going to indicate my frequency, and then I'm going to add the to discharge meds, and then it shows up in the list. You're going to review the discharge medications again from the right side, going top to bottom, checking for dosage, checking for the unit of measure, and the frequency. If everything is correct, you will complete and print on the bottom. You get a message that, are you sure you want to complete? Once you complete, this function cannot be reversed. You're going to say continue if it's ready. This printout at the printer near the location of the patient's room. If you review the reconciliation and there are any changes, there will be 4 lines that you can add medications to, or you can change the medications that are currently printed, make the changes and initial it, and then give to the nurse who will go over the discharge reconciliation with the patient. Your signature will be on it electronically. The nurse and the patient will sign it. The patient gets the original and a copy goes in the chart. And that's the med reconciliation process for the providers.